Welcome again. Today we're going to be discussing another heavy metal, and this particular heavy metal is something that is very commonly found in our present societal environment. We do get it, we do get access to this particular heavy metal very commonly. This, I believe, is one of the leader in metal-based toxicology in our medical field right now, and that's why I always call it the leader in metals. It goes by another name called as shisha. This is lead, and we're going to be focusing on two things. We're going to be focusing on its acute as well as chronic symptoms. The chronic ones are called plumbism, and yes, because it goes by the elemental symbol of Pb. Today, we're going to be starting everything with a case history about a young mother who has brought her child, 6 to 7 years old, to a doctor. And the chief complaints that she came with was that her son has been having loss of appetite, lots of headaches, a bit of a stomach ache. He's been very irritable, and apart from that, upon history taking, she tells that yes, he's been very disinterested in his studies. He's not as happy as he used to be. He is not able to have a lot of energy after a full day at school. These may sound like very non-specific symptoms, but they actually do indicate a level of lead toxicity or lead-based poisoning. Now, this particular doctor who is there examines the child, is going to look for some telltale signs and symptoms, after which he proceeds and does some tests, some diagnostic tests, which tell that apart from looking pale and looking tired, the blood levels of this particular child shows some circulating levels of lead. Now, lead, of course, is not a naturally occurring element inside the body. It's not something that you find like iron or zinc or magnesium. So, yes, presence of lead effectively indicates there has been some or the other type of exposure. So he asked the particular mother, he says, can you tell me if he's been exposed to some sort of paints or any smoke filled environments? To which he says, no, I mean, he is in a normal environment, doesn't work in a factory, does not work anywhere near a smoke filled environment. Smoke filled, why? Because lead is one of the constituents of fuels, that is petrols and diesels, and when they burn, they release lead into the environment. So, of course, she's not been exposed to that environment. Paints is something that strikes her, and she tells that we did purchase some old furniture that was recently painted. A lot of paints actually use lead as a binding agent for the color to be incorporated into that paint, and yes, it is one of those particular sources that chips of paint that fall down, if they come in contact with the child, or if the child does go ahead and eat them, does lead to accidental lead poisoning. Now, this particular case history tells us the relatively common occurrence of lead in our particular environment, and the fact that it can be a very common source of poisoning. Lead, also called as shisha, is a multicolored sort of a compound. In its pure metallic form, it is going to be heavy steel gray metal. But if you see here, metallic lead as well as all the salts of lead are poisonous. Contrast this with arsenic or mercury. In their essentially elemental form, they are not very poisonous. They do have other salts which are poisonous, but metallic lead is poisonous in itself. The common poisonous compounds, of course, are lead acetate, lead carbonate, and lead chromate. These have a variety of colors. You can have something that is very bright and yellow, and of course, bright and yellow colors used for a variety of purposes in cosmetics, and of course, the festival of Holi. And then you have the white crystalline powders of lead acetate and lead carbonate. So, yes, they are something that are essentially very easy to get exposed to if adequate care has not been taken. Lead or shisha also occurs in these particular forms. Now you have your lead monoxide. This is a pale brick red or pale orange colored compound. This is one of the constituents of sindoor. Yes, so if you have somebody here from Bihar, you can go and ask them. In Bihar, there is a festival called as it's a festival in which women, they tend to celebrate it. They tend to go ahead and place large amounts of sindoor all the way from the tip of the nose all the way over the forehead. So yes, in those particular situations, the particular sindoor can be contaminated with this, which is used as a coloring agent. You have lead tetroxide, again a very common compound used in red colored sindoor. You have lead sulfide. It is not very toxic, but it is toxic nonetheless. And of course, the major uses of lead occur in the industries of batteries, paints, hair dyes, electric cable insulation, now not so much, but pottery, ceramics, and petrols. All of this, it is used either as a binding agent or it is used as a coloring agent. The mechanism of action of lead again is very similar to what we find with arsenic and mercury. Here also the predominant activity occurs along the sulfhydryl group. So in all three, the common tool or the common chain is that the sulfhydryl group is always going to be present. But here what it does is it interferes with the action of an enzyme which is necessary for heme synthesis. It effectively is going to be working along the RBCs, and once heme synthesis is affected, it leads to a fall in hemoglobin, it leads to a fall in cytochrome production, and all of this is going to interfere with mitochondrial oxidative phosphorylation, which produces your ATPs and calcium dependent messengers. In both these scenarios, there is going to be an increase in oxidation and cell apoptosis. Here you have to understand that we're going to be doing a whole video on the comparative principles and the comparative mechanism of action, as well as the different types of presentations of all the three metals. We're going to be doing lead, mercury and arsenic together. But you have to understand that despite being the same mechanism of action along the same agent, that is sulfhydryl group, the manifestations do occur in all three of these compounds. The fatal dose is relatively on the higher side. It requires about 20 gram of lead acetate and 40 gram of lead carbonate to be fatal. So it does require slightly more quantity as compared to say something like mercury or arsenic. And it also has a fatal period of 1 to 2 days. This is relatively stable across the entire spectrum of heavy metals. 1 to 2 days or 2 to 3 days is the fatal period which is required. The symptoms of acute poisoning, again very similar to what we find in mercury. There's going to be a metallic taste, there's going to be burning in the throat, there's going to be thirst, and there's going to be abdominal pain, nausea and vomiting. This is again going to be a very similar sort of a characteristic feature that we find in all three of these heavy metals, but the typical presentations do vary. Sometimes, of course, there's going to be some incidences of irritant activity which causes diarrhea. But peripheral circulatory collapse, which is ideally seen in mercury, is also seen here along with headache, insomnia, paresthesia, depression, and these are generally seen when the dose of lead poisoning proceeds to somewhere between 20 to 40 milligram. This is when these are seen. Otherwise, in a sublethal dose, the predominant manifestations are going to be diarrhea, and of course there is going to be peripheral circulatory collapse because of the hemolytic activity. Cerebral ataxia is common in children in acute lead poisoning. In children, this particular poison, what it does is, it does happen to cause CNS manifestations, but these manifestations are generally pronounced in children who are less than 10 years of age, whereas in adults you get the manifestations that are related to the GIT or the peripheral nervous system. The treatment modalities, of course, is going to be very similar to what we found with arsenic and what we found with mercury. The first and foremost is a removal of the toxin that has been absorbed. So gastric lavage is by far the best methodology. But in gastric lavage also we are using sodium or magnesium sulfate. Instead of using activated charcoal per se, we are actually using another amalgam here, that is sodium or magnesium sulfate. Why? Because apart from providing a covering to the layer of the stomach and reducing the irritant activity, they actually do bind with the lead and form an insoluble compound that is not absorbed into systemic circulation and is released thereby. Demulcents can also be used to coat the stomach. These demulcents ideally should not be albumin based. We can use curd or you can use pharmaceutically available ones, and these actually coat the stomach mucosa and prevent further damage. British anti-leukoside is by far the antidote. The treatment modalities still remain the same. Either use British anti-leukoside or use Sasimar and then move ahead to chelation therapy. Last, of course, is penicillamine. This has recently been found to be very, very effective, and this is one of the modalities that is used commonly if you have IV access and a place to monitor. A calcium chloride 10% solution IV, what it does is it actually causes the deposition of lead from the systemic circulation from the blood into the skeletal tissue. Now this is done when the amount of circulating lead is very high. You do not want it causing further circulatory collapse. So we give calcium chloride. It leads to deposition of lead in the skeleton. From where on, yes, it can be extracted later. The peritoneal or hemodialysis is done as a last step mechanism when we have acute renal failure, when the systemic collapse is very severe. It's only then that we do hemodialysis, and of course when it is penetrated deeply into the systemic circulation and chelation therapy is not effective. Apart from that, in acute cases, symptomatic management protocols are followed. You give circulatory support, you give oxygen, you make sure the patient is getting the inotropic measures that are required, and excretion is occurring. Chronic poisoning. Now, this comes generally as a long answer question. It's one of the favorites for forensic external examiners as well as internal examiners. So, it tend to be very commonly asked both in Viva as well as in theory exams. Lead, just like mercury or arsenic, the vapor part of any heavy metal is going to be more dangerous than the actual metallic salts or the ingested route. If you have a vapor of a heavy metal, it does cause more danger. It does enter the system faster. The absorption is more rapid, and the chances of it being in a state where elimination can occur, like the stomach, you can eliminate it by gastric lavage. But if it is inhaled, definitely it's going to cause faster activity and it's going to cause more severe activities. Inhalation of dust and fumes by factory makers where they make white lead and lead paints are one of the most common sources of exposure. Up until a few decades back, there were not specific measures that were adopted by companies. But now, if you go to standard paint companies, the individuals there do have personal protective measures such as full body covering, masks, so as to prevent inhalation of any lead fumes. But earlier on, it was individuals who are working in metal smelting industries where they melt the metals, plumbers, glass polishers, and people who were working with glass. These were the ones who were the most commonly affected with plumbism or chronic lead toxicity. Chronic lead toxicity can also occur due to the amount of lead that is present in the groundwater or drinking water. Many a times this can be due to industrial pollutions, but for a certain period of time after the World War II, a large number of people actually used to consume food which were in tinned cans that were made of tin, and one of the elements that was used in production of this tin, or especially the inside covering, used to be lead. The lead used to percolate inside the foodstuffs, and when the individuals consumed it, they used to have symptoms of lead toxicity. Also, until a few years back, lead was one of the major components for a variety of cosmetic products. This included face powder, lipstick, and nail polish. The absorption can occur through any route. It can occur through the lungs, it can occur through the skin, and of course through ingestion. The raw or intact skin can also absorb lead and put it into circulation. In India, there was a time when there used to be ghee. Ghee is basically a oil-based product, and it used to be stored in containers that were having tin, which was made through lead processes. This used to percolate into the ghee, and slowly, slowly, as people used to consume it, it used to cause toxicity. Again, vermilion or sindoor, which is applied to the scalp by Hindu women across the country, that has also been one of the major sources of lead poisoning. Lead is used as a coloring as well as a binding agent, and this is one of the reasons why females used to be one of the people who are exposed to it. Children can be poisoned through chewing or licking toys, walls, furniture, etc., which were painted with lead-based compound. Right now, India has this policy in which if you are going to buy a toy, they actually specifically mention on it whether lead has been used in it or not, and leaded paint or leadless paint is considered as the norm today. So yes, in India, if they're making any toys, they're using anything related to children, lead is effectively removed from it. But earlier on, it was not so. Chronic poisoning can occur even with a small dose of 1 to 2 milligram of lead consumed on a daily basis. This is an MCQ for you guys. This is an MCQ right here. Chronic poisoning, it can occur even with a quantity as small as 1 to 2 milligram of lead. This is very important for you guys to know. The predominant features, one of the typical presentations for chronic lead poisoning, always going to be facial pallor. Facial pallor is one of the diagnostic or key criteria, and this particular pallor is present around the mouth and is one of the earliest and most consistent sign. The reason for it is not something very clandestine. It's actually due to vasospasm. Circulatory collapse that occurs due to lead is due to constriction of the vessels, especially the peripheral ones. This causes the facial pallor, whereas the hemoglobin-based effects actually occur later on. The anemia that may be found in all complete blood counts can be due to chronic lead poisoning. Specifically, if they do show sideroblast, or which are nucleated RBCs, along with basophils that have small drops or punctures along them, they are called as punctuate basophilia. So if you get a MCQ that is asking you about the earliest and most feasible sign, it is going to be facial pallor, or an MCQ that asks you about the presence of punctuate basophilia or sideroblast with reference to toxicology, you have to jump onto lead. Punctuate basophilia, this is actually how the punctuate basophilia looks like. It looks like punches that are present along the entire surface of the basophil. Very typical presentation that we see in chronic lead poisoning. This is due to the toxic action of lead on the porphyrin metabolism, again related to heme synthesis. Reticulocytes and basophilic stippled cells actually have particular enzymes that aid in porphyrin mechanism. This enzyme called 5-pyrimidine nucleotidase is actually impaired, and this causes the basophilic stiffling that you see here. This basophilic stiffling can also be asked as an image-based MCQ. It's very easy to identify because it looks like punched hole in the entire surface of the basophil. Another thing that is of importance here is that even if you get a CBC report, if there's a simulated CBC report, they ask you to make a diagnosis and they mention basophilic stiffling along with eosinophilia, it is a sure shot indicator towards chronic lead poisoning. Next up, we have something called as lead lines. Now, lead lines, again also called as Burtonian line, are seen in about 50 to 70% cases. So, a third of the cases with lead poisoning, chronic lead poisoning, do in fact have something called as Burtonian line or lead lines. Now, these are found at the junction of the gums and the teeth here, and there is going to be a discoloration that is dark brown to dark blue in. This occurs due to the lead which is going to be deposited here is actually being acted upon by the exposure to the environment, and then it makes a specific type of discoloration. This is generally seen more on the maxillary part of the jaw, that is the upper part of the jaw, rather than the mandibular part of the jaw. We may also find a similar blue line or a bluish discoloration along the entire region in case of mercury, copper, bismuth, iron and silver, but it is more pronounced or it is more evidently seen in lead as compared to these ones. Another symptom that is considered very pathognomic to lead but not diagnostic to it is colic and constipation. Now this occurs in a very non-specific manner. It can occur at a specific time of day. The commonest time when it occurs is the night, and the pain for a few minutes is very severe, but it only lasts for that short duration, after which the individual may regress on the pain, but this may continue for a very long time. So every day for about 2 to 3 weeks, the individual may have colicky pain, may not be able to have a good bowel movement, and this particular pain is going to be there for a few minutes. It's going to be spasmodic in nature, and then it regresses off. Lead palsy is the characteristic or typical manifestation or neurological manifestation of chronic lead poisoning. This is similar to a wrist drop. If you see the particular image here, it is very similar to a wrist drop. It does occur. There may be a precursor in terms of tremors, in terms of numbness. These may progress further if untreated. The muscles actually become weak. There's not a lot of nerves which are damaged, but it's actually the muscles which are damaged more, and this leads to a wrist drop sort of a condition. This lead palsy is also one of the characteristic features of chronic lead poisoning. Usually in lead palsy, it is the wrist which is the most commonly affected part of the body. That's why we call it lead palsy or wrist drop. But then there are other areas that may be affected, such as the deltoid, the biceps. There could be anterior tibial involvement causing foot drop, but rare. It is not very common. Eyes and certain intrinsic muscles of the head and foot may be affected, but again, it's very rare. The commonest site for lead palsy based manifestations are going to be in the wrist. Lead encephalopathy. This may come itself as a short answer question. Lead encephalopathy is said to be present in almost each and every case of chronic lead poisoning. There is going to be some degree of encephalopathy that is present. It can either be something that is on a very initial stage, or it can, if the exposure has been for a very long time, it can be due to a very progressed sort of a stage. It is more common in children as compared to adults, and is generally associated with exposure to the vapor form, that is tetraethyl lead. This is what we get when unleaded fuel is burned. The symptoms start with a headache along with vomiting, which is more often than not projectile in nature. There's going to be sleep disturbances in vision. The individual will have some behavioral changes, may either become anxious, irritable, restless. There may be presence of delirium or hallucinations. The progression, if it is severe in nature, can cause convulsions and can even lead to death in very severe cases. Uh, to actually retard this is actually a difficult task, but the treatment modality for it involves again chelation therapy and supportive care, which can, as well as anticonvulsants, which can effectively make the person to be in a stable condition over a short duration of time. This is lead is actually a very dangerous poison because it's present and its manifestations occur along the entire body and specifically the CNS. But the cause of death is generally due to either gastroenteritis and its resultant shock. So hypovolemic shock due to the nausea, the diarrhea, the vomiting is actually one of the major reasons for it. In chronic lead poisoning, this can be due to other supportive factors that can include failure of systems such as the liver and the kidneys, maybe respiratory failure if it is an exposure that is through vapors, and of course malnutrition and subsequent infections or opportunistic infections. Now, as the heme level or the hemoglobin level goes down, as the blood is effectively weakened, the oxygen carrying capacity is weakened, all of this leads to a generalized degradation of the body. So yes, lead can, in chronic lead poisoning, lead can actually damage quite a lot. But in acute, it is generally due to shock, and which is why even if we just give supportive care in the initial stages, we can help the victim survive. But in chronic cases, we actually have to look at variety of the systems and make a treatment modality such that it can be effectively employed. Its most common medico-legal importance is that this is in accidental or industrial based poisoning occurs. This is very rare that somebody is going to be using it for homicide or suicide. It's not like arsenic. It's not something that is undetectable, and it causes its manifestations over a long period of time. With that, we end. If there's any questions, queries, or comments, keep posting. And next up, we're going to be posting a comparative video on arsenic, lead, and mercury. Then we're going to move on to organic plant poisons and cover the entire toxicology in the coming months. Thank you.